Hello, so this is going to be my trach care video. So I have my patient here, Curious George, and I'm going to start by being outside the patient's room. So the first thing I'm going to be doing is looking at the patient's MAR and her EHR. I'm going to make sure I have the right patient. This is Durbin, date of birth January 17, 1930. I have the right patient. I'm going to look at to see any allergies. I see that she has no known drug allergies, but she is allergic to strawberries and bees. In addition to that, I see that there is a provider order for trach care and trach suctioning. This video is going to be on trach care. So now, before I enter the patient's room, the first thing I'm going to be doing is I'm going to gather all my equipment and supplies that I need. I have my trach care kit. I have my other equipment that I'm going to need. And now we can head to the patient's room. So now I'm entering the patient's room. Boom, 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 knock, knock. First thing I do is do proper hand hygiene. And I introduce myself. Hello, my name is Justin. I'm going to be your nurse for today. Before we start, I just want to do 2 patient identification indicators. Can you tell me your name and date of birth? Patient tells me her name and date of birth. Okay, that means I have the right patient. Before we start, I just want to let you know that the room is private and that the room is safe. Now that we have done that, I'm going to explain the procedure. We're going to be doing trach care. The purpose of this is to keep proper hygiene. We're going to be cleaning the stoma as well as replacing the collar. The purpose of all this is, like I said, is the proper hygiene. Make sure everything is clear. There's no stuck mucus or any type of issues going on with the trach. Now that we've done this, the next step is I'm going to be assessing the patient. We will be doing this by doing vital signs, which are blood pressure, respiratory rate, pulse, oxygen saturation, and temperature. Okay, I've done that. Everything is good. Now the next thing I would be doing is I will be elevating the patient's bed to a working size for me. So the first thing I would do is raise the side rail. After that, I'll increase the height of the bed. Once I do that, I increase the raise the head side of the bed to a semi-Fowler position. Now that I've done that, I bring down the side rail and I insert the pulse oximeter. The purpose of this is that we're going to be removing the oxygen for the patient. So we want to check her oxygen saturation levels to make sure that it doesn't drop too low. At any time, if it does, we can insert the oxygen back and we can take necessary precautions from there. From now that we have that clear, we have the vital signs. We're going to continuously be checking the oxygen saturation throughout the procedure. We can start off, now we can start with the care. So the first thing we're going to be doing is replacing the inner cannula. So I'm going to be putting on my clean but non-sterile gloves. This is going to be an aseptic technique. So I insert the glove. Now the first thing I do is I remove the oxygen and I place it to the side. Now that I've placed it to the side, the next thing I'm going to be doing is with my non-dominant hand, I'm going to be holding down the plate, and with my dominant hand, I'm going to be removing the old cannula. Okay, now I throw that out, and in addition, I throw out the gauze pad too. Now that I've thrown that out, I put back the new. I insert the new cannula. I do the same thing with my non-dominant hand. I hold down the face plate and I insert the new cannula. Now that's good. I can take off these gloves and throw them out as well. I throw them out. Now I'll be doing proper hand hygiene. Okay, now that I completed proper hand hygiene, I can open up my sterile kit. Now it's time to be, we have to make sure everything's sterile, the environment, the setting is sterile, and we cannot break the sterileness. So my trach kit is already open due to issues before with recording. So it should be closed, but it's open right now, but we're going to pretend that it's closed. So I'm going to slowly open up my kit. Okay, now that it is open, the first thing I'm going to be doing is remove, according to ATI, I'm going to be removing the drape. I'll take out the drape, which is meant to put for secretions and stuff for the patient. And I'll be placing it over the patient's chest. Okay. Next, in that empty space now that we have, in the empty section that we have now in the tray kit, I'm going to be pouring the saline. So I take out the saline and I pour it in. Once I've done that, I do proper hand hygiene again. Great. Now that I have proper hand hygiene done, I can don my sterile gloves. As I said before, this was already open, so this is not a perfectly new sterile glove. But for real life purposes, these are clean, perfectly sterile gloves, and we have to keep sterility at all times. Okay, now that we've done that, I insert the glove by scooping my hand into the hole. And I do the same with the other, and the other ones just slip right in. They're a little small on me, so just a little time. Got it. Okay, now I have my sterile gloves on, and I have to be extra careful about what I do from now on. So the first step that I'm going to be doing is taking my 2 cotton swabs and putting them into the saline. So I put them into the saline that I've already made. Okay, great. Now the next step I'm going to be doing is I'm going to be cleaning out the stoma. So I'm going to be taking 1 cotton swab and I'm going to swoop up the bottom side first. And in one motion, I will not reverse it right back, but only one motion, one line, direction. So I'll start with the bottom side. And I'll hold down the face print with the other hand. Boom. Okay, it is clean. Great. Now that I did that, I throw it out. The next thing I'm going to be doing is I'll do the same thing, but for the top side of the stoma with my second swab. Okay, and I cleaned it. Great. Now that I've done both sides, the stoma is clean. I throw out this cotton swab as well. Then I take 1 4x4 gauze and I dry it down. Okay, great. And now and I throw this out. Now the stoma is clean. The next thing I'm going to be doing is replacing the collar. So, side note, I only have 1 collar, so I'm going to be just telling you what I'm going to be doing. I'll explain it to you. So, really, you should have someone else with you to be holding down the faceplate while you're doing this, changing the collar, because God forbid the faceplate comes out, the whole tray tube, everything comes out. It's a big mess, a lot of trouble. It's not what you need. So, but I'm going to be by myself, so we're going to be holding one side of the faceplate, while I'm going to be taking the new one. I'm going to take out, I'm going to be putting in, I'm removing the old one while putting in the new one, but I'm going to be doing it one side at a time. So I'll start with this side. I start inserting the new one while taking out the old one. Okay, and now I'm going to ask the patient to raise his head. Okay, the patient raises his head. We come to the other side, and I'm putting in the new one as I'm taking out the old one. Okay, and I clip it in. I make sure it's sticking on, and now I have the old one. I throw it out. I have to make sure that I can fit 2 fingers within the collar to make sure it is not too tight. I make sure a patient has the proper range of motion that they need. which is perfect. Patient has that, so everything is going well. The next thing I'm going to be doing is taking my 4x4 gauze and inserting a new one inside the tray. Once I've done that, that's perfect. And I can, next thing I will be doing is putting the oxygen back onto the patient. Now that I put the oxygen back on, I remove the drape and I throw that out, as well as my sterile gloves. This is all in the garbage. So now the patient, I'm going to be assessing the patient's vital signs again. I'm going to be making sure that the patient, I'm going to be checking the pulse oximeter as well. I'll do vital signs, make sure the oxygen is perfectly normal. In addition to that, I'm going to be replacing the tray, make sure the tray plate is clean, is changed, the collar is fixed, and everything looks good and normal. Patient has no complaints. Next thing I'm going to do is I'm going to put back the side rail. I'm going to lower the bed, then put back down the headrest. From there, I'm going to tell the patient, here's their bell, call bell. At any time if they have any questions, concerns, any issues going on, please feel free to call the call bell. All the information that I've done and everything, any information that I've collected and everything that I did, procedure, I'm going to be documenting into the EHR. And now I'm going to do proper hand hygiene. And that's it. That is trach care.